Good afternoon, everybody. We'll get started in just a few minutes. We just want to make sure we give a little bit more time to let people in. Hopefully everyone can see my screen.
Yep. Hi.
Hey, Jareth. Okay, thank you. I see a hand up. Is that just you can see me? You can see the screen?
Yes.
Okay.
Are we required to have our cameras on?
You don't have to. We're never going to make anyone have their cameras on, but we do like having faces. So it's easier to engage as a trainer when we can see faces.
Okay.
But feel free to come on and off as you feel comfortable.
And do feel free throughout the training to raise your hand and ask questions, put questions in the chat, all of that kind of thing. We're happy to go down any rabbit holes or answer any questions. We like to keep these very fun and casual and conversational as much as possible. So engagement is super important.
Okay, gotcha. The thing is that I'm attending this and I'm also finishing up some paperwork, so I'm killing two birds with one stone.
Yeah, we've all been there.
All right. I'm going to go ahead. Oh, Kevin, I see your hand up.
Yeah, we need to have some kind of proof that we attended this for our supervisor.
Okay. If you can email me afterwards, I'll make sure to get you something that shows that you had attended.
Okay, thank you.
Absolutely.
Bye.
I usually take a screenshot.
Screenshot works. I can pull a report after with attendance, or we can even give out a certificate if you absolutely need something like that. So, all right. Well, let's go ahead and get started. So hopefully you're here because you're here for the Fidelity Reviewer Training for Supportive Housing, and this is today and tomorrow, so you do need to attend both to be considered trained on these. We're going to, like Anessa said, we're going to try to make it really fun and engaging, and also it's a lot of information to take in, so just be aware that it will be a lot of us talking at you, but if you do have questions or comments, we want to have that interaction with you as much as possible here. So I'm going to introduce myself. My name is Kimberly Castle. I am the Foundational Community Supportive Housing Program Manager. I have to remember, I just changed roles again on the team, so I'm back in the training role. And so happy to be here with all of you. I've been with the FCS program since its implementation in 2018 and come from supportive housing and homeless outreach is my background. So it's nice to see everyone. And I'll let Anessa introduce herself.
Hi, my name is Anessa Williams. I'm the Housing Subsidies Administrator on the FCS team at HCA and formerly was in the Housing Program Manager role. So happy to see you all here today and can't wait to have some more trained reviewers.
Yeah. So we're going to just go over a little bit to just kind of talk about what Fidelity is and what the agenda is going to look like. But if you guys don't mind putting your name and where you're from in the chat, and then also if you wanted to give us a little icebreaker, like what do you like about where you live? We all want to make sure we have choices about where we live. So what do you like about where you live? So today we're going to do a quick activity. We're going to go through some stuff about evidence-based practices, talk a little bit about the core elements of permanent supportive housing. And then we're going to get through, hopefully at the end of today, we'll be through all 7 dimensions of the supportive housing. If not, we'll start wherever we leave off tomorrow. But that's the goal for today, for day 1. And then day 2, again, if we can't get through all those principles, we'll work on those a little bit. And then we're going to get into scoring a review and what that looks like. And then we'll have a lot of discussion about that. I'm hoping that we'll have plenty of time for Q&A. Just know you're welcome to come to as many of these trainings as you want. And we talk about Fidelity all the time. So is there ever a time when you have additional questions and you want to take it offline, we can certainly find extra time to talk through the dimensions and all the things that go into a fidelity review. I also plan to send out a digital copy of our fidelity. I call it the Fidelity Bible, but it's really a guideline, a book that really has every step of a fidelity review in it. So it'll be really helpful to have as a reference at your desk and when you're working with teams and training other stuff. So that'll be in a follow-up email. All right. So if you want to, in the chat, rate yourself on a scale from 1 to 5, how well do you know the principles of permanent supportive housing? And there is no tables, ignore that. That's for an in-person event. You might find some of those in here. What are we seeing?
We've got the whole range here. Some 1s, 3s, 4s, and 5s.
Awesome. Some folks in the middle. So you've been exposed to it, but maybe you really need to be kind of do a deeper dive, sounds like.
And if you rated yourself a 5, feel free to like jump in, add your own experience. We love to hear from folks.
Looks like we've got some HARPS folks on the call, so we know that you guys follow the same practices as we do in FCS. Been on lots of your reviews over the years. All right, great. Yeah, I mean, if you feel like you have a lot of great experience, maybe share in the chat as we're going through some of this about some of the ways that you learned about fidelity, or do you have a favorite dimension? I have a favorite, so I'll probably mention that when we're talking about it. And if you have any guidance for folks in this call, if you're a 5 and you really have been involved in fidelity, then please speak up and share. So just to kind of provide a couple of resources right off the bat, you're going to find the evidence-based practice toolkit at this link. I will mention right now that the link is missing a couple of the guidebooks that go with the toolkit. The Pathways to Housing website has all of them, though. I grabbed them before they took a couple of them down from the SAMHSA one. So we can make sure everyone gets the links for all of the toolkit, not just, there's a couple of missing parts that are on the SAMHSA website. And also next to that is the WISPA inventory that shows all of the evidence-based practices that made it into our WISPA inventory. So you can see that SAMHSA's model is one in the inventory and is considered definitely an evidence-based practice. So what is an evidence-based practice? This is really about like rigorous research. The more research it's done, the more we can say it's evidence-based and that there's outcomes that come along with this. It always has guidelines that go into all the components of the principles of supportive housing or any kind of evidence-based practice. Employment uses the IPS one. And so really it's like a manual, a guide. We like to refer to it as a recipe, right? A recipe to being able to provide good quality service to the folks you serve. So if you follow this guideline, if you follow this evidence-based practice with all its components, then you're going to get those outcomes that we so desire. And so this is different than like monitoring a program where you're just looking at program deliverables or contract monitoring. This is really about looking at a program in all its entirety and determining what components can you move around towards closer to fidelity to be able to serve folks well and consistent. So just some of the premises of permanent supportive housing, one of the things we talk about a lot is when you hear permanent supportive housing, do you think about the evidence-based practice of permanent supportive housing, or do you think about the building, right? And so there's a lot of questions and discussions about what PSH is. And so when we're talking about it, we're obviously looking at the services. And this model can be brought into a PSH building to provide services there. So they are two different things, but really the idea is these components, right? Good, effective partnerships with wraparound care for folks, right? Unbiased info for staff to make their own decisions. We want people to have choice, individual plans, individual services, so folks are being served well in what they need. And then, of course, staff's roles to support the client. I don't like the word client very much. You might hear me say participant more often, but it's really about that you really want to be serving someone well and that they get to choose what that journey looks like and you just walk alongside them. And so that's really what PSH is all about, being able to have a permanent place with supports brought in. So these are some of the key elements, and we're going to go into the principles a lot deeper than this. This gives you kind of a basic. So we want folks to have rights of tenancy. You know, we want them signing a lease that you and I would sign, and thinking about that they have their own place, right? That it feels like they have ownership of where they live, and that they get choice in what that looks like for them. That there isn't a lot of special provisions. I don't know how many of you have gone and helped sign a lease with somebody, and there's like 4 addendums to that lease with all these different additional rules. Every one of those slowly takes full rights of tenancy away, right? Because there's now rules and regulations and curfews and all the things, right? And so as close as we can, as much as we possibly can, we want folks to go into places that don't require all of those additional rules. Of course, if they choose that, well, that's their, you know, choice, but we want to look at having them have as much full rights of tenancy as possible. Make sure that support services are available. We in FCS always have to say this is a voluntary program. No one should be required to receive services. It's really what they want. Of course, we want people to engage, but if they just needed housing and they don't need us further than that, then we say, okay, you know, you let us know if you ever need any more support, and they can go and move on with their lives without having a case manager and services. So we really want folks to understand that programs are voluntary and that they should want to be here, and we need to be flexible because of that. So of course, we talk about permanent, time unlimited. We want people to be able to stay as long as they want in housing that they choose. And of course, we know that if they get to choose that, they tend to stay longer and be more successful in their housing. We want it to be affordable. So 30% or less of their income towards rent. And we know a lot of folks, I think, I don't know, Nessa, if you're seeing this, but a lot of folks are paying upward of 50% or more towards their rent. And so we really want to help people connect with ways to, you know, have lower rent costs if that's possible, connect them with any kind of resources that exist out there, and of course, talk about supported employment every chance we get with folks to remind them that there's a lot of really great purpose behind engaging in supported employment. Making sure we're talking about housing preference, making sure that folks do get to have a say in what they want and need in their housing, making sure that we're integrating people into their community. So really in thinking about how someone is getting involved in their community and being part of that. And we'll talk a little bit more about all of these in a little bit. All right, so I don't know how many programs, and you can raise your hands or you can throw it in the chat, but how many people already use an assessment outside of the FCS WellPoint assessment to ask the wants and needs of someone's housing? Do you use those? Yeah, I see some hands. It's hard for me to see everybody because I only see one screen. That's great. Yeah, throw your hands up. These are really important. This not only opens up the conversation to get to know your participant really well, but it shows that you're listening and that there are things that they can want in their housing to be happy, to be, you know, be able to stay in their recovery, to sustain their housing, right? And so it's not just about the checking the boxes of making sure that they have what they need, but also what else can you want in your housing that we might be able to get for you or incorporate in that search. So making sure that we are using, you know, some assessments, you know, talking with participants about those things. A lot of times that'll come up organically in those conversations, but we love seeing housing assessments when we go out and do Fidelity reviews. One of the ways we can see that you are providing choice in the type of housing someone's going into by asking them the questions. What would you like to see in your house, right? One of our questions we ask in Fidelity reviews to the participants we interview is, if we had a magic wand and you could live anywhere you wanted to live, anywhere, what would that look like? And some are perfectly happy where they're at, and others have these dreams of being off grid on a farm, you know, whatever that may look like, right? And so it's great to allow them to have those, to be able to dream what they want. And someday that might be a long-term goal that they can get to. I'm going to turn it over to you, Anessa.
All right, so we're going to dive into informed choice here. We will talk about all of the 7 dimensions of permanent supportive housing, but we would argue that choice is the most important one, if we could pick a most important one, because sometimes somebody might choose something that is not in perfect alignment with Fidelity, with those 7 principles, but obviously what the client decides is best for themselves is always the most important thing. And to expand a little bit more on what that partnership can look like, the analysis that I like to use, or the analogy that I like to use, is a driver and a GPS. Our job is to be the GPS for our participants. We can give them the different routes and the pros and cons of those different routes. And ultimately, they are the one driving the car, deciding what route they're going to take. We have to take our opinion out of it and just offer that unbiased information as much as possible so they can make an informed choice. Sometimes that might conflict with what we think is best for them or what we would do for ourselves. But it's really important that we don't let our own biases about the situation influence our services toward them. You can absolutely express concerns with a choice that somebody is making, like, oh, hey, you said that you are hoping to get sober, and this building that you said you want to live in has lots of drug activity in it. How do you think you're going to be able to maintain sobriety if you have neighbors that you know are using drugs, right? You can have conversations like that, but ultimately, if that's their choice, that's their choice, and we're here to support them. We are happy to revisit the conversation, or if something doesn't work out, we're going to help them go on a different route. But ultimately, it's always the client's decision, and they need our unbiased and non-judgmental information as much as possible. And obviously, informed choice is something that is going to be ongoing, right? Another important tenet of permanent supportive housing is flexible and voluntary services. And a piece of that is that folks can access different kinds of services and change their minds about what kind of services that they are participating in at any given time, right? So it might be multiple conversations about, accessing employment services or peer services or something like that. Somebody might say they're not interested in something at first, and we keep revisiting those kinds of conversations over time, continue to offer new information to people. We always know if something is a no once, it might not be a no forever. Obviously, while we're working with folks, a lot of things are going to change for them. They're going to encounter new barriers. They're going to accomplish some of their goals, and they're going to need to come up with new goals, right? So the process of informed choice should be going on the entire time we have a relationship with them, the entire time that we're serving them. Okay, so why is it important to assess fidelity, right? Why are we all here? Fidelity is really important because, as Kimberly was saying, we know that fidelity means this method has been proven to work, right? When agencies follow these evidence-based practices, people get housed and they stay housed and they have better quality of life. And that's what we want for our clients. And the closer agencies can follow fidelity, the better outcomes they are going to have. That being said, obviously our network of providers is very diverse. We have all kinds of different providers, but really the closer you can get to fidelity, the better, obviously, the closer you're following that recipe. Pieces of that are efforts should be structured to maximize choice as much as possible, right? I've gotten lots of questions during fidelity reviews from agencies about like, well, how are we supposed to offer choice when there's so little housing available in this community? Or there's, it's really like you can live in this recovery residence or it's going to take me 6 months to get you in somewhere else, right? As much choice as you can possibly offer is the better, but we understand sometimes you might be constricted by things like coordinated entry or the community that you're serving or justice involvement, all kinds of barriers to housing like that. A team should be using fidelity dimensions as part of their daily practice, right? This should be part of like training and onboarding new housing specialists. It should be integral in an agency is how are we making sure that we're offering choice to folks, making sure that our housing is integrated as much as possible. How are we helping things be affordable for folks? Fidelity dimensions can also be used as part of clinical supervision as well, right? I've been both in direct service and been a supervisor. These are great tools to help those direct service, those housing specialists and case managers stay on the right direction with the kind of services that they're offering and the way that they're interacting with clients. Housing support is a huge overarching umbrella that can encompass so many different pieces that are like directly and indirectly related to housing. And keeping fidelity in mind is a great way to ensure that the services that we're providing are meaningful, they're person-centered, and they are in some kind of way helping that participant find and maintain housing. There's also studies showing that permanent supportive housing as a model is effective. We see more and more of that all the time. It's like we were saying, it's very evidence-based. And a big part of that is client choice, right? Having voluntary services and emphasizing client choice rather than just like, you can take this unit or you can remain unhoused or you can live here, but only if you're sober. We know that that kind of thing is not as effective, right? People need to have their basic needs met before they can work on goals and improve quality of life and all of that kind of thing. PSH also produces a good return on investment, right? We know that it is less expensive to house people and give them what they need than to let them be unhoused. Which I think, in that case, why would you not want to do it? It's amazing. We want people to be safe and indoors and not unhoused. And also, as a bonus, it's less expensive for everybody that way. And we know, obviously, steady housing promotes improvement in other life domains, right? If you are stably housed, you are going to have better mental health, better physical health. You're more likely to be able to be employed or work on other personal goals that you might have. Housing is like the basic need that we all need, obviously. I'm sure all of you know that, and that's why you're all here and working in this field. What gets measured gets done. This is really important too, right? We can know all of these things and be like, yes, of course I want to offer client choice to my participants, right? But if we are not having some kind of metric to compare to and measure against, there's really no way for us to know that we're doing it well, right? It's the exact same thing as saying like, I really need to go on a budget and then not tracking your spending, or I really want to lose weight, but not like counting calories or exercising or anything like that. We need to have a solid metric to track how well are we following these dimensions of permanent supportive housing. And that is what Fidelity is. Tomorrow is when we really talk about scoring and what each dimension looks like in practice. And that'll be really fun and interesting. But just keep that in mind that oftentimes if we're like self-assessing or internally assessing without measuring, it's probably not as accurate as if we're actually using a tool. So that's why we have this. Oh, are we doing this like an activity?
This is a group activity, so I don't normally we wouldn't be able to do this in the webinar. So if you guys want to chat in the chat about a dimension that I always use choice and talk about how we measure choice. Like Anessa said, that choice is a really hard one because we know that housing market is terrible, and so we have to find creative ways to offer choice and think about, are we giving them the full menu of options? Are we thinking outside the box? What kind of discussions are we having around choice? And so we have to measure that based on documentation we see, which we'll talk about. We base it on interviews we have during the Fidelity review. So a Fidelity review does consist of interviewing staff and leadership and participants. And so it allows us to see how we ask, how do you offer choice? And so there's,
I was just calling to see what time Ryland's doctor's appointment was at on.
Make sure to put yourself on mute, please.
8:15 a.m. Are you going to be able to get there and everything?
Yeah.
All right.
Yeah,
And what are the challenges of providing this stuff for the dimension, right? And what are the challenges around offering choice?
What's that?
What time does the baby have to be at school?
Hang on, you guys, just a second.
She has to be there before 8.
I don't know. We can't.
Really.
Okay, thank you. I was like, I couldn't find it. I'm trying to find it. So how do you know if you are offering choice? So when I go into a review, I'm looking for assessments to see. I'm looking through chart notes to see if they're asking for certain things, and then you're going out and looking for those things. I'm looking to see, are they seeing more than one unit in before they pick a unit? And a lot of times nowadays, we know that a lot of times there isn't more than one choice, right? And so folks are like, it's either a take it or leave it kind of thing. But that we have to be able to measure that somehow. And so those are the things that we look for to say we can clearly see that participants are getting choice in this program through the documentation, through interviews, and through other things that like policy and procedure. So these are the 7 dimensions. I don't know, raise of hands of how many have gone through an FCS 101 and heard these dimensions. I know many faces already, so I'm sure there's plenty of you who have gone through some of these, but we are going to go into them to talk. And if you have heard them, a refresher never hurts anyone. I always say that. It's always good to have it just like ingrained in our brains, right? So These are the dimensions to live by as a supportive housing specialist. So it's going to include choice, separation of housing and services, decent, safe, and affordable housing, housing integration, rights of tenancy, access to housing, and flexible and voluntary services. With flexible and voluntary services being the biggest dimension of Fidelity, it covers and encompasses a lot of this stuff, but each one has really important elements so we want to go over. So let's talk about choice. When we say full menu of options, we don't just mean the full menu of what you think is right for that person or what they can afford. You really need to say, this is all of the options that exist in our community. And then, as Anessa talked about that informed choice, then you start talking about the different things that might, factor into a choice made, right? Maybe it's how much it costs. Maybe it's who you can live with. Maybe it's all of those things. So we want to look at types of housing, talk about all the types of housing and have those conversations with your participant, pros and cons, things they wish for, and then you'll be able to kind of narrow it down. Sometimes it's about going and looking at different units for them to be able to determine what they actually want or what they don't necessarily need. I don't know about many of you, but when I've asked somebody what they want in housing, sometimes it's like, I want a mansion, Kimberly. I want, of course I want this farm out there with all the animals. And so, or I want a 2-bedroom with a pool. Okay. And sometimes they're maybe don't have the income for something like that, but going and showing them, sometimes you can talk through the pros and cons of having a unit that big. Or do you really need, washer and dryer in unit, or can you walk down the hall and do your laundry there? Right. So it's all those different elements. A lot of times they'll be like, oh, I don't know that I really need the pool. I don't know if I'd really use it, and start thinking about those things so they can determine what really they want and what they can afford. But you never want to limit it to based on what you think is good for them, right? Choice of living arrangements. We want folks to have choice in who they live with and what that looks like. The composition of their household is important. Maybe they want a caretaker. Maybe they want their spouse or boyfriend. Whatever the case may be, we need to talk about what those choices allow. If you go into recovery residence, you're not going to be able to live with. You don't even get to choose your roommate a lot of times, right? Oxford, absolutely not. But maybe they need those support. So talking through all of those things. Maybe the voucher that they're using doesn't allow anyone but themselves on the lease, things like that. So having those conversations to inform them to help them better make those choices that might work for them. So I don't know if you guys want to throw down some housing types. I'm curious if we cover all the bases out there. Throw in the chat some housing types that exist out there. What does the full menu look like for your community? Scattered site. Yep. Yep. Rooms for rent. SROs, rooms for rent. Yeah. I think that desired housing checklist maybe came from me. I think I made that back in the early days. Yeah, there's so much out there, right? There's recovery houses, there's project-based, there's subsidized housing, tax credits, tiny homes. I mean, there's the array is out there, right? There's global leasing, which used to be called master leasing, where folks like agencies own their housing and then lease it out to folks who have a harder time being housed. A lot of times with folks that have felony backgrounds for certain reasons can't live in communities with children. So we would, global leasing is a great way to be able to provide housing for folks that maybe you're coming out of institutional stays that may not be able to just integrate into the community in the same way. So yeah, there's lots of options out there. So when you're looking for all the options to provide your participant, think about that. Look through your community and through the different housing types that exist, and then kind of keep an inventory, and that'll help you be able to provide more choice for your participants. Whoops, did I skip one? I can't ever tell. Okay, no. I'm trying to keep track of the slides I'm on, so I'm not doing Anessa slides too. So sorry, Anessa. I don't think I am yet. So the next one.
No, you're good.
Separation of housing and services. This one is really important, especially when you're talking about, this is one that the permanent supportive housing project-based buildings have a harder time with because there's staff on site. They have front desk staff, they have, case managers, they have sometimes the rental office, the leasing folks are there. Everyone's kind of on the same in the same space, right? We really want folks to have separation because it's really important that you as case managers who are providing support services can be just that, the support to the participant. So that way, if they want to tell you something like they've relapsed or they've spent all their rent money on something else, they feel comfortable enough doing that, knowing that you're going to support them and their housing isn't going to be held over their head by you. So we don't want case managers giving out leases or giving out evictions, giving out notices, doing inspections for other than just to kind of have an idea if it's going to pass an inspection. We don't have you guys doing official inspections, things like that. So we want you to stay in that support role and the housing management stay in their role doing those kinds of things, doing that housing management piece. So there's good separation. Of course, you're going to help and you're going to work with the housing or the landlords to help somebody stay in housing, but your role is not to do those tasks that a housing manager or landlord would do. And that allows there to be separation so that they get to be the landlord and do the things that you would never want to do, like give out an eviction notice. We would never want you guys paying rent on someone's behalf. You can take them to pay their rent, but we would never want you carrying money or keys on behalf of somebody. Okay. Also in Fidelity, we look at where the housing staff is stationed. Do they have an office where it's private and you can go and see folks in the house or in your office? Are you offsite and go into housing to see folks? So really looking at the different parts of separation and thinking about what does my job description say and what does their job description say, and then making sure we're keeping really good boundaries around those. I don't know about you, but I used to have a few landlords that like doing the social service side and get a little too involved in the folks living there, right? And that can get really tricky. And in different settings, when there's multiple staff like PSH, sometimes it's confusing to the participant of who to go to when, right? Do I go to my case manager about this repair that needs to get done? Or do I go to the housing coordinator or whatever that does all of that kind of thing? So having those conversations with your participants, if they do live in project-based where there's a lot of staff, on who does what so that they're more clear on who to go to when. The next one is safe, decent, and affordable. This is really about, where folks are moving into. Are they paying that 30% of rent or less? And so are we asking, do they have a voucher? Do we need to get them connected to a voucher depending on where they live? Are we talking about supported employment and understanding that that's a way to really sustain housing long term? And it also has so many other benefits to the participant, right? We're also going to be looking at housing quality standard inspections, or HHSs, which is housing habitability standards. I always have a hard time saying that one for some reason. And different programs, depending on the program, require those to be done. FCS and Fidelity is asking you to look at that to make sure folks understand, are they moving into a home that does pass inspection? If not, are there things that we can utilize to have a conversation with the landlord about getting a repair done before somebody does move in, so that they have a voucher coming down the way that they would be able to stay and not have to relocate because this unit doesn't pass? Are we having that conversation with participants to ask, do you care if it passes? If you're paying out of your own pocket, do you care? I've had participants choose to definitely live in places that didn't pass for their own reasons. Maybe it's the area of town they wanted to live in. Maybe it's close to their services. There's lots of reasons why folks choose those things, but making sure that we document if they do decide to live somewhere that doesn't pass, are we documenting it? And then of course we need to keep those inspections in our file so we can see that that is a conversation that we had with our participants. And that is something that we look for. We look for those leases, we look for those inspections, and we do a fidelity review. All right, turning it over to you, Anissa.
Okay, housing integration is the next one, and this measures to the extent that folks are living in regular units that any of us could walk into and apply for, right? They're not set aside for folks who are chronically homeless. They're not set aside for folks with disabilities. They are available for anybody to rent. And the reason that that's important is because we know there's a lot of stigma behind like transitional housing, behind those big PSH buildings that have like a big agency name and logo on it. And it's very obvious what it is and who lives there. And oftentimes you'll hear the community complaining about like, oh, they're putting in a new PSH building downtown. And obviously there's a lot of unsavory opinions about those, which is obviously gross and unfortunate. But If somebody's living in a unit that you can drive by and have no idea that they're any different from you or participating in services, that's obviously ideal. It's going to be easier for that person to make friends in their community, to become employed in that community, to access resources independently and build connections than if they are being, discriminated against or have biases against them for the kind of housing that they live in. So in order for an agency to be considered like doing well at housing integration, we would want 25% or fewer of their housed participants to be in set aside housing. And obviously, some folks do choose to live in clean and sober or transitional or PSH. There's totally valid reasons that folks choose those. But that's where it comes back to client choice and making sure they understood, if you move into PSH, there's going to be staff in the building 24/7. You're going to have a little bit less freedom. Or if you move into clean and sober, you're going to be submitting to drug tests. And are you okay with that? You're not going to have a regular lease. We need to see all of that documented, that yes, this person chose to live somewhere that is not as integrated. Or we need to see if somebody is perhaps living in whatever housing situation that they're living in, maybe it is PSH or something like that. They're being offered the option of like, hey, would you maybe be interested in a Section 8 voucher? Or how do you feel about living in PSH? Would you like a little bit more flexibility and freedom and, more integration? Conversations like that should be happening with folks.
And just to piggyback off that a little bit, or just to add to this, the affordability dimension and the housing integration both require a little math to be done in the Fidelity review. What happens is we have a housing log, and some of you may know it well, some of you may already hate it, some of you maybe are using something similar, but we do have a log that tracks how much people are paying for the rent and what that percentage is, and as well as what type of housing someone's going into. That allows us to score appropriately for Fidelity. So when it comes to the integration piece, we're looking to see how many people are in set aside versus how many people are out in scattered site type housing. So that's where that housing log comes into play. If you heard of it, if not, I'll send one out in the follow-up email so you have it. Typically, we'd like the whole caseload to be on there, but when we're looking at Fidelity, we're looking for those house folks, the type of housing they go into and the percentage they're paying towards their rent.
Okay, rights of tenancy is the next one. Obviously, we want to see that folks who are being housed have the same rights of tenancy that any of us could expect. They have full legal rights to the unit, and for the principles of permanent supportive housing, they can live there for as long as they want, so long as they continue to meet the obligations of the lease. There shouldn't be any additional provisions, ideally, about, submitting to drug testing, participation in services, even things like, guest policies, like no guests after 10 or guests have to sign in and present ID. Those are not things that we would see in a standard lease. So that's not considered full rights of tenancy. It's also obviously important to make sure the participant understands the lease, whatever is in there, prior to them moving in, and to make sure that you do go through the lease with them, ideally prior to the day that they're getting the keys, so that you can go through point by point and see, is there anything weird in here, or do you understand what the rules and expectations are? Obviously, when somebody gets the keys, that's the exciting part, and they want to move in stuff and just get settled in. Nobody wants to sit down and read like a 10-page lease with all the addendums and things like that. So it's always just best practice to go over that ahead of time, see if there is anything questionable in there, and make sure that the participant's okay with everything that's expected. And when we do a review too, it's very important that every housed participant has their signed lease in their file. It can't just be like a standard boilerplate one. It has to have, their specific name, unit number, rental, monthly rent amount, all of that kind of stuff. Access to housing is the next one. This is basically like housing first, right? Folks shouldn't have to demonstrate any kind of readiness requirements, and readiness requirements can look like anything from sobriety, having income, having spent time in transitional housing, or anything like that. The only readiness requirement we want to see is folks coming in and saying, I am ready for housing and I'd like to look for housing. And you're like, great, cool, let's talk about it. Research does not show that people with mental illnesses do better in housing if they pass a readiness screening, right? There are some agencies that do like a readiness assessment of sorts, but we don't want to see that as like a pass fail, like if you don't do well on this, you're not going to get housing. We want to see assessments more as like, oh, these are some barriers you might have in looking for housing. But regardless of what those barriers are, we're going to help you and we're going to help you immediately, right? It's important to be aware of, biases about readiness, both in like specifically in policies, right? Saying something like, we're not going to help you look for housing until you're meeting with your case manager regularly, right? We don't want to see that written down in a policy, and we don't want to hear that from any staff too, right? Like maybe the policy says access to housing and housing first is prioritized, but maybe staff are like, well, I have a lot of people on my caseload and I don't really start looking seriously for housing for somebody until they're like meeting with me every single week and returning my calls, right? Obviously, it's easier to house somebody who's very engaged with you, but we're not going to intentionally or unintentionally prioritize anybody. Anybody who says that they're ready is ready to get that housing. And that's what we want to see both in policy and in practice. Housing should seek to eliminate barriers to housing stability, right? This is related but not related. Obviously, we like to see that agencies are following up with folks after they're housed as well, right? Making sure once you get that housing, we're still meeting with you to see what you need, what barriers come up after that. And the other point on here is privacy of the unit is the tenants to control, right? They decide who they let in and out. They are the only one that has a key unless somebody else lives there too. If their case manager or whoever shows up and they don't want to talk to them, they don't have to let them in because it's their unit. They have legal rights. They decide who they're letting in or not letting in.
And I just wanted to talk about priority a little bit more because when we do a review, we are looking at is your team prioritizing a certain population first? Like, are you going to get someone who's chronically homeless housed faster than somebody that's at risk? Those kinds of things. But again, one of the things we look at is your program in any way going out and doing outreach to bring people into the program? So are you going and spending so much time at a shelter to bring people in? Are you doing intakes at another medical office or mental health facility? Are you partnering and are you actually doing outreach? So are you partnering with outreach teams? Those kinds of things to show that you are prioritizing those folks that are truly unhoused. So those are questions that you would get asked in an interview, or you would ask in an interview or review interview, is what kind of priority is it? First come, first serve, which a lot of programs are, and that's fine. But you do score higher if you're prioritizing folks coming into the program. You're bringing them in. We got through these really fast.
Yeah. Flexible and voluntary services is the last one, and this one is also the largest dimension in that it has a lot of different pieces under it. Part of it is tenant preferences being explored at entry. So when you do your initial assessment, you're asking them all of the different things that they might need help with, might want access to. You're presenting them lots of different options beyond just like, you want to get housed, cool, let's look for housing. We know that there's a lot of other pieces that can be involved in that. People can accept or refuse treatment to other services, and staff should continue to offer support and use flexible engagement, right? For example, say you help somebody get housed and then they're like, I'm good, I don't want to talk to you, like, I'm fine now. Awesome. We respect that. That's their choice. And maybe still like call or drop by in a couple months and be like, hey, just wanted to see how you're doing. Hello, brought you something nice. Or similarly, like I was saying earlier, somebody might initially say like, nope, I'm not interested in X, Y, and Z. That doesn't mean don't ever bring it up again. It might mean like it's a no right now, and maybe if they express interest later, we'll talk about it, or I'll mention it again on down the road. Service options remain available for tenant choice and change as needed or as preferred by the tenant, right? Services should always be tailored to what their need is. If somebody, for example, needs to meet with you super frequently for a while because they're having some kind of crisis, they're getting evicted, they're really close to getting housed and need help putting some pieces into place, that's totally fine. Or if somebody is very stable, low need, doesn't need all that much from you at the moment, totally fine to meet with them less, right? It should be very dependent on the client's individual needs, and all of that should obviously be in the service plan as well, which I think we talk more about tomorrow. Also, where, when, how often you meet with somebody should always be the client's choice, right? We love to see when case managers are able to meet with somebody in their unit, if that's something that them and the participant are both comfortable with. We want to make it as easy as possible for folks to access our services, rather than saying like, I'm only going to meet with you in the office, figure out a way to get there, or I'll give you a bus pass and, come meet me. That's a lot harder. That's a bigger barrier. And somebody who's already maybe kind of ambivalent about meeting with you is going to be less likely to take those steps. We want to make it just as easy and accessible for folks as possible. If that means picking them up, meeting them at their house, if they want like a ride to the grocery store and you talk in the car and while you're shopping, like great. All of that is totally fine. Risk management and crisis planning should be part of the plan of support and developed in partnership too, right? Who do you call when I'm off work and, you're having like a mental health crisis at 3 a.m? Do you have somebody for that? Or what do you do if it's after hours and you have a leak in your apartment? Or, so many more things. Services provided should be consumer driven and recovery focused. So again, it's always the client's choice what they're participating in, and there should be no repercussions against them for not participating in anything. You can offer all of the services that there are, and they can take whatever they want or take none of it, and it's all totally fine. Quality and adequacy of services are monitored and maintained. So this one is tricky for a lot of agencies to meet, but ideally we like to see that caseload sizes are no more than 15 active participants on anybody's caseload. Because obviously the fewer people you have on your caseload, the more time you're going to have to spend with each individual person and work on getting them housed, help them develop good goals, help them, find the resources and tools to meet those goals. And, that being said, Fidelity is very much a balance. If you have to have more than that to, keep the lights on, we get that too. But definitely a big red flag if you're doing a Fidelity review and it's like 45 people per caseload, which, I've been there. We've seen that before. Team-based behavioral health services is great too. If you are an agency that offers, things like clinical support and peer support and employment and housing, it's awesome when a whole team can wrap around somebody to help them, right? To the extent that they want to participate in multiple services. But it's always nice for somebody to have rapport with, multiple staff in case, you're on vacation or you're sick or you leave your job. We want to make sure that participants are comfortable going to multiple people for help and support. And 24/7 service provision. This one is one that actually favors like permanent supportive housing buildings a little bit more, because those are more likely to have like security staff or like front desk staff after hours that can help folks with crises. But if you are an agency that just does scattered site housing, an on-call phone is a great way to meet this piece of Fidelity. When I myself was a service provider, what that looked like was case managers taking a after hours phone for a week at a time. Participants would call if they had like a crisis, like mental health, arrest, fire, flood, things like that. Okay, that is all of the principles. Do we have questions? Sorry, Kimberly, go ahead.
Going to add something. So with the behavioral health stuff, even if you're not a behavioral health agency, we want to see that you have partnerships with behavioral health and SUD providers. So one of the things I look for in a review would be ROIs, releases of information for folks that say you can coordinate care with other providers, primary care, substance use disorder. We're going to be looking for releases of information. We'll look to see if there's any MOUs with providers to see that you have a partnership where you're doing shared staffing or, staffing shared participants and having those regularly. Especially if you're a provider that has a lot of folks going to the same behavioral health org or things like that, those can be really handy to have those partnerships in place for sure. And then one of the other parts that Anessa touched on is the services being provided and being consumer driven. We really want to see that you have that a organization has a formal feedback loop, that there's a place where participants can bring ideas, complain if they need to, share what they think would help the program be better, right? And then have a way that gets looked at by leadership, and then the participants know what gets done with that stuff. It's really important that they have some input into the provision of a program. It's that because they're the ones getting served. So we really want to see that you're either doing surveys or some way to get some feedback from folks, or a number of different things. Sometimes the buildings are able to do, PSH buildings have like little committees that live there. But any agency can put together something like that. I used to work for one that had a city council, and it was participants that came in for outpatient, and they got their little badge that they wore, and they each had a responsibility, and they had meetings on a regular, and then they would give that feedback back to the leadership, and that would get reviewed, and then we determine if there was something that we could implement, right? So those are really important things as part of this that we would be looking at in a Fidelity review. Okay, questions about the principles or thoughts? Kelly, I see your hand up.
Thank you. So I'm not sure if this is agency policy or if it is part of the Fidelity piece when reviews are happening, and what you folks are looking at, what we're looking at. To show due diligence in our notes for somebody that may be on outreach, they're not active, to show that we are continuing to reach out and say, hey, I'm here. I'm assuming that is part of the Fidelity piece, to show that we are reaching out.
So we do ask, what is so we look at caseloads, right? And then we ask active versus inactive, or what you guys at Pioneer call outreach, right? That's your inactive caseload. And most agencies have a policy about how many times you contact somebody before you'd put them on inactive or before you close them out of a program, right? And so we would be asking, like, what is your caseload? How many of those are active versus inactive? And then I always ask, what do you have a policy around disenrollment? What does that look like? Is there three calls and then a letter, and then they get put on inactive? So we do look at that to see what kind of what is built in as part of your policy around folks staying active. Because one of the things is you may have a lot of inactive folks, but are you trying to re-engage them? So, then it's having conversations about creative engagement and things like that to get people to want to, work with you a little bit more often. But of course, there should always be a policy that talks about how those steps you would take to put someone into the outreach or inactive space.
Got it. Thank you.
Michelle, your hand's been up, but I don't know if it was up from something else we asked you to raise hands, or if you had a question. She must not have a question. Okay.
There you go. No, I didn't have a question. That was from earlier when we asked to raise our hand about something. Sorry about that.
You're fine. Michael, I see your hand up. Oh, you're muted.
There we go. It took me a minute to figure out how to unmute. I saw that you had in your presentation flexible engagement strategies. You mentioned it again. Can you give some examples? Because that's not very clear to me what that might look like.
Yeah, so, once you know your participant, you also know some of the little carrots you can dangle to get them to want to hang out with you, right? So one of the things we used to do is we'd pick up the day-old pastries from Starbucks. They donate those out, and we'd keep a freezer of them. And so when I was having trouble finding certain people, I'd grab their favorite pastry that they don't get very often, right? And, make a phone call or go stop by and say, hey, I've got your favorite scone. I mean, there's lots of different things, making what you're doing with them really fun. Like when I have somebody that's looking for certain things for their house, we'll go yard selling one day, or we'd go, to the thrift store, and we'd be thrifting together, and it would be more fun and more engaging for the participants than just going to Kmart. And, I can't believe I said Kmart. Does that even exist anymore? But going to the store and getting, something for their house. It kind of is more of an activity and then that gets them kind of comfortable and talking in a more informal setting. So there's lots of little things like that. I used to do this in a small community, but McDonald's and Dutch Bros were happy to always give out free coffee cards. And so I kind of dangled those sometimes to get people to hang out, and thinking of those creative things that might get them out, wanting to get out of the house with you. And then talking becomes pretty organic in those settings. So just thinking about that. And I actually have a creative engagement training. I haven't pulled it out in a while, but it is something that we can offer to talk about different ways to engage folks. I don't know, Nessa, do you have other thoughts?
Just to go off of what you were saying, being able to transport folks is a huge way to kind of organically have conversations, right? Somebody might not want to like come down to the office and meet with me or want me to hang out in their apartment, but if I'm like, hey, I can take you to like the Winco across town that's not accessible by bus, and we have a nice chat on the way over there, and then, you know, I help them pick some stuff out grocery shopping. That's a really easy way to like naturally build rapport, and being able to offer somebody a ride somewhere is always a solid incentive to meet with you.
Since we're not supposed to give out cigarettes, right?
But if you have to.
Another thing I used to do, and we did this in groups, but FCS, you can't do groups in the same way, but we take folks to the Dollar Tree and say, we're going to play Chopped. You know, we're trying to teach budgeting. So on a small amount of dollars, whether it's 5 or 10, they're going to use 10 of their dollars, and we would randomly pick things, and then they'd go back and have to make it or learn how to cook something. And that would be kind of fun too. We did that in a group setting, and I've done it with individuals. We're like, let's just go pick some random things and see what you can make out of that. And so it just gives it more of an like time together. You're talking, but you're teaching a skill set, and it makes it fun so they want to hang out with you. So those are just some ideas. Jarrett, I saw your hand up, but it went down. I guess you had an idea, but did we say it already?
Yeah, it wasn't an idea. It was just more of the fact that it's because we don't necessarily transport at our agency. So rapport building, I heard Anessa mention like bus rides and stuff. So huge rapport building opportunity for us is like a lot of the peers and participants that we work with are really motivated towards recovery, and they're new in it. And then we just so happen to have peers that are a little bit farther along in their recovery. So we attend like self-help groups with them. We do a lot of like riding the bus with them. It's like, hey, do you want to meet me down at the 1414 club? And then we'll go to the Nooner or something. And then that gives us opportunity, not necessarily during the self-help group, so to speak, but like on the smoke breaks or the bus ride to and the bus ride from.
Thanks, Jareth. Kelly, I see your hand up. Okay.
I forgot to lower it.
That's
I
okay.
forgot to lower it. Sorry.
You're fine. Michelle, you have a question?
No, I just had a comment that we also can't transport with our agency, and the insurance was crazy. But we provide like Halloween candy at Halloween time, bowls of candy sitting around on our desks. We always have bottled water, chips, and or granola bars, so the client can get something to snack on when they come in. And they really do look forward to that. And it's an incentive to keep coming back, because we don't have a lot of like go to Starbucks or McDonald's in our small community. They don't do that, or they'd be bombarded all the time. We just wanted to throw that out there, that just having like bottled water and a granola bar, they really enjoy.
Yeah, and if your agency is able to, maybe it's not a one-on-one interaction that's billable, but if your agency is able to put together like recovery, art classes, and things like that, we had a lot of engagement that way, which fostered relationship for them to want to come back on one-on-one basis. So me and my colleague used to do a recovery art. We'd come up with something that they could make for their house every week. And we had a huge group of people that loved that. And then through that, we were able to better engage with some of those folks that weren't showing up for appointments, or we were going to have to go out and get some time with them. So it allows that relationship building. So sometimes those group activities help foster one-on-one interactions as well. So be thinking about how you can creatively do some of those things. And if you are a small community and don't have access to some of the freebies and things, think about creative ways you can get some of those resources. Because I was in a small town too, and we went and knocked on everyone's door. What can you help provide for us? And even if it's like a closet that has, clothing and hygiene items and things that they need that they maybe don't have access to, is a great way to get engagement. We just talked to a provider recently that has these little bucks that they give them, and when they engage in appointments and go to their regular appointments, they get these bucks, and then they can go to their store and use some of that dollars to get things that they wouldn't necessarily be able to have access to otherwise. So that's like, they want to come to their appointments. They want to show up for different events, because then they get those bucks, and then they get something out of it too, on top of just getting supported, right?
I'm glad you brought that up because I was about to talk
Yeah.
about that. It was really cool. We haven't seen, or at least I hadn't seen another agency do that before. And I thought it was awesome. It sounded like participants were like very enthusiastic about participating too.
Yep. So I think that's really cool. Is just thinking about the ways that you can incentivize those interactions, whether it is water and candy at the office, whether it's you can go out in the community and get some resources. There's lots of ways to get folks. And sometimes it does take a little carrot on those times when they're just not feeling super motivated to come in. You know, are you going out and doing home visits so that you're going to them? Sometimes that's just the incentive is I'll talk to you, but you have to come to me kind of thing. So, you know, home visits can be a really important part of what we do and allow for some of that. Sometimes people are more comfortable in their own spaces, right? I had a participant that I couldn't get to talk much at all in the office or even in her beautiful apartment, but once I got her in the car going for a drive with some music turned on, she told me everything, right? So it's just getting to know your people. So then I got to go for a drive and talk to my participant, and she was, you know, that was where she felt comfortable. You know, so whatever it is, you know, and you can ask like, what would make you want to engage more? Have those conversations, ask those questions. Erica, I see your hand up.
So my coworker, John Cahill, and myself, we often will reach out to people who we haven't seen in a while. We'll just show up to their house and you know, knock on their door and say, "Hey, we're just checking in on you. What's been going on?" And we will continue to do that until they feel as if we actually care and they will start engaging on their own.
Yeah, absolutely. I used to do that all the time when I wouldn't have an appointment or someone would cancel. I'd think about what participants maybe I did need to still check in with, or maybe I knew ones that, you know, maybe wouldn't come in to me as often, but might have something going on that they need support with. So I'd go knock on the door and just check in. That's a perfect way to get them to believe that you're going to show up every time too, and that you're actually there for them. That's great. Yeah, there's lots of ways. And, you know, always feel free. You can always reach out if you're really struggling on something and you just need to brainstorm with folks. That's, you know, that we're always happy to brainstorm with you to think about those kinds of things. It's, you know, sometimes we get stuck with somebody and we can't figure out how to get moving forward with them, right? They're just feeling stagnant and they're not, you know, wanting to come in, and you've run out of all your ideas, right? So lean into the provider network. Everyone's got great ideas out there. You can call me and Essa. Our team is always happy to help folks brainstorm those things. And sometimes it just takes someone else's, you know, thoughts to come into play to really think about other things you can do for folks. Is there any other questions? Okay, so we've gotten through all of the dimensions. Now we're moving into scoring. We have about 40, well, we have about an hour till the end, but I was going to say, Nessa, you have to hop off a little bit early, so we could go till 2:45 if we wanted to go ahead and keep jumping into scoring. Do you want to do that?
Yeah, let's do it.
Okay.
Okay.
All right, now we're going to get into the nuts and bolts. I do want to mention this scoring matrix is a little funky. It's, you know, it's not going to have consistency in the way that most of my brain works, where I want it to all be the scoring's all exactly the same, but it's kind of different how they do the scoring here. I also want to mention that this toolkit was really designed for behavioral health organizations. So when we're looking at the different pieces inside those dimensions, the language might seem a little funky or maybe not fit perfectly. So ask questions. We'll talk about it. There's some places I say we do a little bit of an interpretive dance to get there, because not everyone is behavioral health, but we can still look at the dimension, and all agencies can meet these if they really work in their policy and procedure and all of the things to incorporate into a program. So the scoring criteria is weird. It ranges from 1 to 4. Sometimes it's only 1 or 4, so either they're doing it or they're not. Really cut and dry there, and sometimes that's a bummer because sometimes they're sort of doing it, right? Sometimes it's 1, 2.5, or 4, and sometimes you get a 1, 2, 3, or 4 in a score. So you'll see on the slides coming up, well, it won't show the slide for a while, but you'll see on the slide coming up the matrix tool that we use. Sorry, just started playing with the slide deck. So if someone reaches a 4 in Fidelity, that means they've met Fidelity in that dimension and there are no recommendations. Part of the Fidelity review is writing a report at the end that gives them all of the recommendations, and then also we like to highlight strengths of areas that folks are doing really well in. So this isn't just, you know, fix it. It's also about celebrating the great things that programs are doing and making sure that they know that we see that. So when you get the toolkit, like I said, you'll see that it's a little bit funky in the way that we score, but it all works in the end. And then 1 means it's not implemented. There obviously needs to be recommendations. And so anytime you're scoring somebody a 4, you have to know that there's no recommendations you could give them in order to give them a 4. So when we're doing our consensus scoring, we really have to think about that. Do I have anything I'd want to recommend here? And if I do, a 4 is not appropriate. All right, so we do a consensus scoring. So if you've ever been on a review with Nestle or anybody on our team, we take a review team out with us. There's only 1 lead from HCA, and then the rest are peers. We do this peer-to-peer so that you all can be learning from one another and seeing how other programs are providing these services. And it's a great way to network and learn new things to take back to your program or offer new things for someone else to take back. So we always have a group of about 3 or 4 with us, so that we can have a full team. That way, when we score, it's not just one person determining the score, but we do a consensus, meaning everyone has heard and seen and read the charts and all of those things. And then we have to come together and talk through each score to determine where we land as a consensus. So it's always a group effort to make sure scoring happens and everyone's voice is heard before a score is given. And Brian, feel free to reach out to me. I have one coming up pretty soon. You just have to be able to travel. I'm not sure where you're located. All right, so scores are added together all the way. The highest score is a 28. You won't see a perfect score in Fidelity. That's the one thing about this. This is continuous quality improvement, but that score is going to move and ebb and flow depending on all sorts of factors, like the population you may be serving goes into recovery residents. That'll affect a score, or maybe you're a PSH building, and so everyone pays 30% or less of their rent. That's going to affect scores. So it can really change and depend on the model that you're working within, the housing types you're able to offer, the populations you're serving can all factor into a score. And even though somebody may get a 24 one time, we might do a follow-up on them the next year, and maybe it's a little bit lower because something happened, or they changed a policy, or whatever the case may be. The idea is that we're working towards closer to Fidelity as much as you can. And we always say, start with what you have the most control over when you're moving your stuff around to meet Fidelity. Work on the lower hanging fruit, and then those bigger things that might take a little bit more time, then you can really focus in on those. But those are some of those recommendations we give folks when we're writing that report for a Fidelity review. I think the highest, and we say don't focus on the score, but the highest score I've ever given was a 26, like 0.28 or something. And so, of course, everyone loves hearing that. They are like, oh, we got an A. But really, it's not about focusing. When we go into these reviews, we tell people, don't focus on the score, focus on the recommendations. That's really the gold in this. Focus on hearing what other people on the review team have to offer. And the score is just a bonus that you can say you got the score, but really it doesn't capture the whole essence of what goes into a review. And so it's really about those recommendations that you can get. Do you want to start with some of these, and we'll just take turns since we do this?
So for scoring choice of housing, the pieces on here are tenants have a choice in the type of housing that it is, right? So we can see in documentation and in interviewing staff that folks are being presented with, clean and sober apartments, tiny homes, home ownership, room rental, all of that kind of stuff. That's scored on a 1, a 2.5, or a 4. Real choice in housing unit. This is one that can be tricky depending on like coordinated entry. It really depends on the community that you're in and what kinds of larger policies there are too. So this is a piece of it that sometimes agencies don't have a lot of control over, but are tenants are they able to look at multiple units before being housed in one, right? We know with coordinated entry, sometimes it's like, this is what's available, take it or leave it. We also want to see that tenants can wait without losing their place in line, right? So can they say no to a unit? Can they say no to several units? And if they do, say no to a few things, is there a waiting list? Is it like, if you say no 3 times, you're moving to the back of the list and we're going to help somebody else? Ideally, somebody can just say no as much as they want, wait for the right unit. That would be a perfect form. And that's scored a 1 through a 4. Choice of living arrangements. Again, this is one it's largely going to depend on like the kind of housing program that it is or the kind of voucher somebody's using. But we want to see that, to whatever extent possible, the tenant gets to decide if they live with somebody else, who they live with, are they sharing a room with that person, right? We know that a lot of transitional housing situations, they might have a roommate and probably don't get to choose who that is, right? But ideally they get to choose if they live with somebody else and what that looks like. And that's a 1, a 2.5, or a 4.
And actually with this one, this particular choice of living arrangements, we had a lot of folks push back in the early days because even if you had 50 people housed and only one of them was in like Oxford or recovery residence where there wasn't a choice, they got a 1 for the entire dimension. And so after a couple years of having a lot of feedback about that particular one, we went to SAMHSA and I call them the Fidelity gods and asked if there was a different way to score this. And so we now do this as an average. So a 4 would be anyone in scattered site who you have full choice of who you live with. There's no requirements for living alone or anything like that. A 2.5 would be something like recovery residence or transitional, where maybe you have a choice in the room or roommate. And so that one would be all the folks that live in that setting would get a 2.5, and then a 1 would be folks that like live in Oxford where there's absolutely no choice, right? And they're assigned a unit or whatever alone. And then we average the score across that based on how many people we scored on. So that one allows for an agency who does use recovery residents for their folks not to be have to take such a hit in that particular one because they also are housing people in scattered sites. So that's kind of how that's done now. That'll look a little bit different than what it says in black and white on here. Michelle, I see your hand up.
Yes, I had a question. So on the scoring for that, so of course, we're a very small rural town. We only have 4 low-income housing complexes in all of the county. So a lot of our clients, when they come out of treatment, they choose to go to an Oxford house. That's their choice, even though they don't get to pick who's living with them, who's their roommate, but they need that ongoing support to stay sober for a little while longer. How would you score that? Because it's their choice to go there.
Well, if they're choosing Oxford, they're going to get a 1. The people that choose Oxford would get a 1. And part of this is you also have to understand with Fidelity, you may get really high scores in one dimension and a lower score in the other. For that one, like they get a higher score in choice because you're providing choice to those participants in like the type of housing they want to go into. But because of the type of housing they're choosing, they don't have choice in composition. And although they're choosing that, it's still going to be scored a 1 because that's part of that dimension. So that's the conversation we've had a lot is like, but the truth is it'll ebb and flow depending on, you might get higher scores in affordability, but lower scores in integration because everyone's living in the same building, but they all pay 30% or less, right? So there's different places where you are going to get a higher score in one, but possibly get a lower score in the other because they kind of don't align the same. Does that make sense?
Yeah, Kevin said that's why a perfect score is impossible. And that's also, Erica said it doesn't mean you're doing something wrong. Both of those comments are absolutely true. That's a really good example of why the score is definitely not the most important thing. And if we were seeing that in a review, probably that section would sound something like, we recognize that the clients that you're serving are prioritizing sobriety and they're choosing Oxford House. And it's fantastic that you're offering them those options, right? It doesn't mean you're doing something wrong. It's just
Okay.
Plus, I mean, I really think that it's true that it does sometimes like, oh, but we're offering them, they're getting the choice and we want them to obviously live where they want to live. So those are just some of the things that we have to take into account. And then as an agency, understanding that there's going to be certain areas that you're just not going to meet high fidelity in because of maybe it's the model you work in, maybe it's the policies, certain policies you can't change. And then there's other things that you can because you can move things around and change those kind of processes or whatever to make it work that way. So I don't ever want to look at a lower score as a problem because you're probably getting a higher score somewhere else. And so they usually kind of balance each other out quite a bit. And it doesn't mean you're doing anything wrong. And again, this is continuous quality improvement. This isn't an audit. You're not doing things poorly. We're just working towards making sure we have really good quality services. So,
thank you for clarifying that for me. I appreciate it.
all right. Moving on to the next one is the separation of housing and services. This has 3 pieces to it. And when you see the matrix, you'll see what we mean. We have an overline, and then there's pieces of each dimension. First is the housing provider also providing services. So we usually hear through interviews with staff and seeing maybe job descriptions, whether somebody's overlapping their role, right? If they're doing kind of a dual. So a 1 is there's definitely housing specialists or housing managers doing housing specialist work. A 2.5 would be there might be some overlap, whatever that looks like. Like maybe they don't ask you to do evictions, but or maybe they're getting a little involved, trying too much to be kind of the housing specialist as opposed to staying in their role as a housing manager. And then of course a 4 would be it's very clean lines between what the housing manager is doing and what your housing specialist is doing. Then it flips back the other way to is the service provider collecting rents, doing those kinds of things? Are they doing roles that a housing manager would do? And so same idea, if it's a 4, they've got really clear lines. 2.5 means they might be doing some overlap. Maybe they are holding keys, or maybe they are, handing out notices or whatever. And then 1 means there's definitely overlap and there's dual roles that they are providing. So sometimes, it depending on the model, you sometimes see housing specialists also have to do some of those housing management roles. And so we really want a clear line there. And then the last one is, where are the service providers located? Or do they have an office that's private that you can see somebody in? Are you in the bottom of are you going into buildings and having your offices inside a housing unit? What do those look like? And so really the highest score would be staff are off-site in offices where they can go out into the community and meet people where they want to be met, or folks can go into the office and see them. And then a lower score would be if they're based in like project-based housing and your office is there, where it's harder to have privacy and things, and where the landlord would maybe hear things that are going on with that person where they shouldn't be able to hear those things without consent. Any questions about separation of housing and services? Vanessa.
So for dimension 3, which is decent, safe, and affordable, this is a principle that does tend to actually really favor like PSH buildings or set aside units, because it all comes down to what percent of income are tenants paying towards rent, and does housing meet the HQS standards, right? So if it's a unit that is subsidized, both of those things have to be true already. So if that's all of the units, they're going to get a perfect 4. Obviously, ideally, we want to see that everybody's paying 30% or less, and everybody's living somewhere that would pass HQS standards, right? But if perhaps they are not utilizing any kind of subsidy or voucher, they might come across a unit where they would have to pay more than 30%, or a unit that might not pass inspection. And it's okay for them to choose that. Again, client choice. Like, I know you really like this place. It's 50% of your monthly income. Let's talk about how we're going to like help you budget for other things if this is where you decide you want to live, right? We want to see conversations like that happening if somebody is choosing to live there anyway, or likewise if it doesn't pass the inspection. But the affordability piece is scored a 1 through a 4, and that's based on what percentage of participants are paying 30% or less for their rent. And for the HQS standards, that's scored a 1, a 2.5, or a 4. And oftentimes we will see agencies get dinged on this one, not because the inspections aren't being done, but because there's no proof of them in the files. A lot of case managers are not in the practice of getting a copy of the inspection, but if you're not, please start doing that so that you can put them in your housed participants files, and we can see for sure, like, yep, this was done, everything's all good here. Or if it didn't pass, like, this is why it didn't pass, and this is why the participant said they wanted to live there anyway.
And this, in the affordability piece, we do score this differently. This is one of those math ones. I always say the only math I ever do is Fidelity math, which isn't actually true. But so when someone that's paying 0 to 30 would receive a 4. So we'd do all the 4s. Then we'd look to see how many people are paying between 31 and 40%. Those people would get a 3. Then it's 31 to 40, get a 2, and then the 41 or 50 and above, I skipped something. Anyway, you get the logic. So then we add them all up and then divide by how many people are housed, and that gives us the score for that particular one. So it's not going to be a flat like 2.5 or a flat 4 or a flat 3. It's going to have an average score. And that's so that we're scoring to make sure that the folks that are in those paying that 30% are getting those full 4s. All right, housing integration. Are tenants placed in units set aside for individuals with disabilities, and are they living in scattered sites? So this, again, we look at the housing log or ask, who's living in what housing types. And really to get a 4, it's 25% or less of folks are in set aside units. So we look at that, we look at how many people are in recovery residence, in project-based, subsidized, and then how many people are out in those scattered sites. And the folks in the scattered site would get a 4. And then folks in, if someone got less than 25% of people in set aside, they get a 4. And then it, depends on what the percentage is, what they get scored below that. So there's different ranges of scoring or percentages to score based on, and the matrix that you guys will see later has all of that kind of broken down for you. And so we'll make sure that you get a copy of this. You're going to get that Fidelity book that I'm going to make sure you all have, and so you'll have lots of materials to review after this review. So the scoring is a 1 through 4, and this one is just a single dimension. It's a single thing we're looking at. It doesn't have any other parts to this dimension. Pretty straightforward.
Okay, rates of tenancy. The first point on here is there a lease in the tenant's name? So again, this is one that I've seen agencies get dinged on if people are housed in scattered site and they probably have a normal lease, but we don't see it in the file. Like, we have to assume, we can't just give you the benefit of the doubt. We have to ding you on that if there's no signed lease in the participant's file. But that's scored a 1 through a 4. Then the next piece of this is, does the tenant have to follow rules that are not typically found on a standard lease agreement? That's scored a 1, a 2.5, or a 4. And again, that's things like mandated participation in services, UAs, specific guest policies, things that you wouldn't expect to see like in your own lease or in a regular non-programmatic lease, any of that kind of stuff.
Tara.
Sorry, can I? For folks that are living in a situation where they would not have a standard lease, like for example, Oxford House, clean and sober, room rental, maybe from like a friend or family member, we still like to see something in their file that indicates like what the rules and expectations are. If they're paying rent, how much is that? Again, just to prove like this person knew what they were getting into before they moved in. It was explained to them. They're aware of it. There's something on paper to refer to, right? Even if it's just like Bob is paying $300 a month plus utilities to his brother to rent this room, right? Or these are the standard house rules of this Oxford house in the participant's file. We like to see stuff like that if there's not a standard lease.
So if you're, I was gonna say anything that has what the person is agreeing to, Jareth, usually we don't look at shelters as housed, so we wouldn't look at those necessarily, but if they're in any kind of like transitional, then we would want rules. But I don't think it's a bad idea if you have somebody staying in a shelter, and anytime you have a lease, you can hold them to like, this is what you agreed to, this is what the landlord agreed to. So anytime there's rules around where they're staying, I would say it's best practice to have something in the file so that you can help them refer back if they don't recall, or they're like, hey, Jareth, can they do that? And you'll be like, well, let's look at what you signed or what you agreed to. So even if it's not going to count as a lease, it's still not a bad idea just for best practice to have those so you can advocate on behalf or remind them of what they've agreed to.
Yeah, it can just be helpful to have that for the participant to refer back to over time.
Fidelity is not an auditing company. Fidelity is not an audit. Fidelity is continuous quality improvement. It's really about learning. It's done with peer-to-peer, so folks from other agencies and then one of us leading. It is the PSH model is the evidence-based practice we use to do a Fidelity review. So thanks, Sheridan, for dropping that in. So that's really what it is. If you have more questions about that specifically, we can definitely touch base offline. I have a dog trying to have the zoomies under my desk right now, y'all. Gonna knock something over. Okay, dimension 6, This is again, access to housing. So is there any readiness criteria? This is where we would look at policy and procedures, right? And see if there is any of those biases built into the policies that we have in programs. This is going to be heard through interviews when we talk to case managers. You know, Nessa gave a good idea about like, what does it look like when biases do happen? And sometimes we know that the agency does feel like they're housing first, but then when we have interviews, we'll have like even one case manager that says, well, I don't usually house until this. And then they're training the next staff, and then they're training the next staff, and suddenly there's bias built in to the services being provided. So we really look at that. We want to hear from all the case managers. That's why we do so many interviews, because we need to get the full picture. Maybe one person is doing one thing and the rest of the agency is doing another, right? So that might just be a training issue with a single person. But when you start seeing those things pop up. So we're looking at policy and procedure around readiness. We're looking at documentation to see if there's anything that says anything like that. If there's certain like things that they're required to sign to say, you know, I have proven myself, whatever it may be. I've seen all sorts of weird things out there. So we're looking for those things to catch whether there is any readiness requirements in a program. We're asking folks in programs, are you prioritizing folks that have housing instability, or do you first come, first serve, right? So first come, first serve, agencies would usually get a 2.5. They're not really going out of their way to prioritize. And FCS kind of already organically does that in the way that our risk factors, our health needs and risk factors kind of do that for us. But if I see you doing outreach and going out and having 2 times a week, somebody goes and does intake somewhere or those kinds of things, and you're bringing people in, you'd get a higher score, you get a 4. And then if you're definitely not doing any priority, then you get that 1. And I don't ever think I've given a 1 in this dimension that I can think of. Usually programs are first come, first serve, and they're getting at least a 2.5 here. Who holds the keys in the unit? We ask case managers all the time, do you have access to keys? You know, are you holding keys for participants? You know, we want to make sure folks have privacy and that nobody's entering a unit without permission, right? And so sometimes there's previous consent that, you know, if something happens, you can come in my unit for this reason, and I've consented to this, and there's documentation around that. Typically, housing specialists shouldn't be having keys or access to keys, right? And we're only going into a unit when invited by the participant. So that's a 1, 2, 3, or 4 on that one.
Okay, flexible voluntary services. Again, this is the biggest one with like all of the different pieces underneath it. But the first one is there a menu of options for types of services to choose from, right? And this doesn't necessarily have to mean that your agency is providing all of these services. But if somebody wants something that you personally can't offer, your agency can't offer, you are doing care coordination, you are helping them find those resources, you can connect them to whatever they're trying to access. That's scored a 1 or a 4, which personally I think is weird. That should maybe have a 2.5 in there, but I digress. Can a person change the frequency and intensity of services? That's a 1 or a 4. So again, what I was talking about earlier, right? If somebody needs to access you more, can they do that? And if somebody's like, hey, I'm good right now, like check on me in a couple months, that should be fine too. Like we want to see both of those extremes and everything in between. Can a person choose no services? That should always be an option as well. Our services consumer driven. So that's kind of what Kimberly was talking about, about like participant councils, or you know, what kind of engagement is being done formally to ensure that participants have some kind of input into what kind of services they're receiving, or what the program looks like, or how they're being engaged with. We want people to have opportunities to say, like, you know what, I would really like to see this change made with the policies, or I want to see this being offered and it's not being offered. We want participant voice to be as embedded in the program as possible. Typical caseload size for service providers. Again, a perfect 4 would be 15 or less. It's a 1 through a 4. I want to say it's like 20 or 15 to 20, 20 to 25, like 35 plus would be a 1. Our services provided by a team. That's a 1 through a 4. So again, does somebody have multiple points of contact at the agency? Are they being served by different folks? Do they have rapport with different folks on your team? And services being available 24/7. This is a 1 through a 4. And this this doesn't have to be the extreme of, only 9 a.m. to 5 p.m. or their staff on site 24/7, right? This could also, in between there, that could be staff have the option to flex their schedules if somebody needs to meet earlier or later, or staff can work on weekends, or folks have like staggered schedules or different schedules. That can be included in there as well.
And so some of the things that we would look for in a Fidelity review to see some of this, so the service options and the, being able to change services, we would be looking at ISPs or goal plans or housing plans or whatever you call them at your agency. We'd be looking for those, and we'd be looking to see that they're getting done and that it shows voice and choice from the participant, right? So we want to see quotes from participants, seeing it's definitely them that is kind of the author of their service plan, right? And then for, being able to change services, we're going to look to see if they've been able to modify those goal plans throughout the time, because goal plans are those living, breathing documents. So are we seeing that those are being updated in real time? Is it showing that someone's completed a goal and now has added a new goal? Are we seeing that through the story of their file? So we would be looking for those things to see if someone's really being offered the choice of what services they go into, and that we're kind of showing the voice of a participant through quotations in their documentation and things like that, to make sure we're really seeing that they're the ones that are the author of what's happening through their services. And then when I go down and when we talk about the consumer driven, that's another voice and choice one too, with the input, but also are you documenting using the participant voice in those times? And then also, are we seeing ROIs for coordination of care? We can't really provide services as a team without the rest of the team, right? So it is internal folks, but as well as those external folks that we're collaborating with. Maybe it's their behavioral health, their SUD, maybe it's their primary care doctor, maybe it's some other support system, maybe it's the voucher holder, but we can't be doing any of that unless we have ROIs in the file. And there's lots of times right here, we're doing so much coordination of care, and I'm like, there's no release of information in the file. So we need to be looking for those as well to make sure that that exists, and that would be a recommendation for folks to remember that those ROIs need to be updated, and it's important. So those are all little pieces of things that we look for when we're looking at the review through these dimensions. Okay, we've come to a good stopping place for today. I think we'll start back up tomorrow, finishing off, what does it look like to score, and go into some interviewing and things like that. But I wanted to make sure we answered everybody's questions for today. Is there any additional questions about the information we brought to you this afternoon? Everyone's experts now. Okay.
If you are processors like I tend to be, please feel free to email us in between today and tomorrow, or after the training, or if you want us to do a deep dive or cover a specific topic or do a training for your agency, all of that is totally welcome and fine. I'll put our emails in the chat too.
There's also a Pathways to Housing website. If you don't know about the Pathways to Housing, there are, it's a resource website we created, but there's also 2 sections that have e-learning modules on them. There's some that are based right around Fidelity, and there's a module for each dimension. So if that would help kind of embed some of this for all of you, it's a great way to just kind of use it to kind of test your knowledge of it, because there's a little I think there's little tests at the end. So those are helpful to maybe check out in the meantime. I know we're going to see everyone tomorrow afternoon and get more into it. But yes, please reach out any questions, and we are looking forward to seeing you all again tomorrow.
Hey, Kimberly, before you go, can I ask you a question?
Absolutely.
It was kind of what I put in the chat earlier about a possible review coming up, and you told me to get with you after the class. What is that? Do you know where it is, or what day?
Yeah, let me email you on the side with the dates. I have to look it up.
Okay.
I know it's going to be in January, and it's down in Cowlitz County.
Oh, well, I live close to Cowlitz County. I'm in Vancouver.
Oh, okay, that works. Yeah, I'm going to be part of the review team. So
okay,
maybe
so I'm putting my email in the chat for you.
Perfect. I just don't want to forget, and I'll reach out to you on the side.
You are amazing. Thank you so much.
Thanks, Brian.
Yeah, you're welcome. Let me just get this up. There we go. Okay, so I put it in the chat. It should be there for you. And then I'll see you tomorrow.
All right. Thanks, everyone. Have a good afternoon.
All right, cool beans. Take care. Bye-bye.
Bye.